Our topic is routes of drug administration. So, what do you mean by route of drug administration? It is a way how the drug enter into our body. So, that is the route of drug administration. How the drug is administered into our body, the way we call it as a route of drug administration. There are many different routes of drug administration. Some are commonly used, some are rarely used. We discuss the list of routes of drug administration. First route of drug administration or commonly used is oral route. When a person swallows the drug through mouth, the route is termed as oral route of drug administration. Next, the same way, buccal route. When a drug to be administered is placed in between the cheek and gum of the mouth of a person, that route of drug administration is termed as buccal route of administration. So, the buccal route is a drug will be placed between the cheek and gum of a person mouth. Next route is sublingual. So, as the name indicates, sublingual. So, it is a route of drug administration. When a drug is placed underneath the tongue, that route of drug administration is termed as sublingual route. The next is intraocular. Intraocular, the drug will be administered into the eye. That way of route is termed as intraocular route of drug administration. And the next is intraotic. Intraotic, the drug will be administered through ear. It is a through eye. It is a through ear. And these three are through mouth. In first form, that when a drug is swallowed by a person through mouth, that is termed as oral. When a drug is placed between the cheeks and gums of a person mouth, that is termed as a buccal route. When a drug is placed underneath the tongue of a person, that route is termed as sublingual route. When a drug is administered into the eye, that is termed as intraocular. When a drug is administered into ear, that is termed as intraotic. Next is transdermal. When a drug is administered through skin. When a drug is administered through skin, the drug will be directly entering into the bloodstream. That is termed as transdermal route of drug administration. A drug in the form of patches will be choosing this route of drug administration. Next is subcutaneous. As the name indicates, again sub means underneath. So, the drug will be placed under the skin. The drug will be placed under the skin. This is one of the route of drug administration. Next is rectal. So, rectal means the drug is inserted through rectum. The drug is inserted through rectum in the form of suppository. So, the drug will be in the form of suppository. So, the suppository form of a drug when administered or inserted through rectum, the route of drug administration is termed as rectal route. So, mostly laxatives and some anticonvulsant drugs like diazepam drugs will be administered mostly by this route, rectal route. Next is through vagina. So, when a drug is inserted through vagina, the route is termed as vaginal route. The same thing, the drug will be in the form of suppository or in the form of a cream or in the form of a gel or in the form of a capsule. So, drug in the form of suppository or cream or gel or capsule, when inserted through vagina, that route is termed as vaginal route of drug administration. So, this vaginal route will be a very painless route of drug administration, and the drug will be entering directly into the bloodstream, and the effect of the drug will be very soon, and mostly antifungal drugs and Antibiotics will be administered through vaginal route to treat some infections like vaginal dryness, atrophy, etc. So to treat some conditions like vaginal dryness, atrophy, or in case of some hormonal treatments. In case of some hormonal treatments, the drug will be administered through vaginal route in the form of anything, in the form of suppository cream or gel or capsule. Mostly antifungal or antibiotics will be introduced or inserted through vagina to treat some conditions like hormonal treatments, vaginal dryness, etc. This route is termed as vaginal route. It is considered as a very painless route. But if a drug is in the form of a solid suppository, that may cause some discomfort. Other than this route is very preferable. Next is nasal route. When a drug is inserted into the drug through nose. When a drug is inserted through nose, the route is termed as nasal route. It is also considered as a very comfortable and painless route of drug administration. Through this route, high concentration of the drug can be administered and the effect of the drug will be very quick. High concentration of the drug can be administered and it is considered as a very easy and painless route of drug administration. But it also has some limitations like it depends upon the size and features of the person's nasal activity and how the drug is administered. The dose and size effect of the drug will be depending on this condition, on the nasal activity of the person who is able to administer. And the tip of the applicant should be very clean. If it is not clean, it leads to some recurrent infections. So to prevent that, the tip of the applicator should be very clean. So the route of drug administration through nose is termed as nasal route of drug administration. High concentration of drug can be administered and it is a very painless and easy route of drug administration, but it has some limitations. And from nasal route, the drug can enter into stomach through nasogastric tube. Through nasogastric tube, the drug can be inserted or inhaled through nose directly into the stomach. So this route again we call it as enteral route. Directly drug or medication directly into the gut. Gut includes from oral to the anus. So insertion or injection or indication of the drug in the form of medication directly into the gut, that route is termed as enteral route. That is oral route will be preferred, means from oral route directly to the gut. So that is termed as enteral route. Sometimes other approaches will also be used. One route of administration is nasal route. Through nasal route, the drug will be administered through nose directly into the stomach via nasogastric tube. And the drug can also be introduced directly into the intestine through nose. Directly into the intestine through nose via nasointestinal tube. Via nasointestinal tube, the drug can be directly introduced through nose into the intestine. So these two routes means introduction of drug directly into the gut through any route, through mouth or nose. That route of administration we call it as enteral route. So nasal route means the drug can be directly inhaled into the respiratory system, or we can administer the drug through nose directly into the stomach through nasogastric tube, or the drug can be administered from the nose directly into the intestine through nasointestinal tube. So this is termed as nasal route of drug administration, and which also includes enteral route of drug administration. And the next route of drug administration is rectal, vaginal, nasal, intramuscular, directly through injected into the muscle, through muscle, intra-arterial, through arteries. The drug is administered through arteries, intravenous. The drug is administered through venous or through veins. The drug is injected directly into the arteries, that is intra-arterial. the drug is directly injected into the vein or introduced into through vein, that is termed as intravenous. The drug is directly introduced into the muscle, that is intramuscular. Next is intraosseous, through bone marrow. The drug is introduced into or administered through bone marrow. So that is termed as intraosseous route. So these are major routes of drug administration. We have total 15 to 16 routes of drug administration. The way of the drug entering into our body system, that is termed as routes of drug administration. So out of these, we have discussed few of them about nasal, about vaginal, about rectal and enteral. So these are the routes of drug administration.